Dear medical student.
And I'm Vito Agrusa. I'm also a fourth year medical student, and we're from Michigan State University College of Osteopathic Medicine. On this case, we were working with Jonathan Lovey, DO, from the Beaumont Health Department of Internal Medicine, Trenton, Michigan. And our poster today is on Heyde syndrome, and this is a case presentation of a patient we saw at one of the outpatient clinics in Trenton. Now I'm going to hand it over to Nadine for the introduction.
So, aortic stenosis is a common valvular defect that we see in many patients. Defining symptomatologies are syncope, dyspnea, and angina. In addition to the various cardiac issues that we see, blood loss via angiodysplasia is another manifestation. Angiodysplasia consists of arteriovenous malformations that can cause chronic bleeding in the GI tract and the skin. Angiodysplasia in relation to aortic stenosis is coined Heyde syndrome, which can progress to acquired von Willebrand syndrome. Blood flow through the stenotic aortic valve alters the conformation of the von Willebrand factor and exposes sites on A2 domains that can be cleaved by the plasma protease atom TS13. As a result, the multimers are reduced in size and are hemodynamically less competent than the intact large multimers. The resulting acquired von Willebrand syndrome may lead to the findings of chronic anemia and unexplained GI blood loss, potentially due to the bleeding of intestinal angiodysplasias.
So, regarding the case, our patient was an 89-year-old female with a history of asthma and severe aortic stenosis, and she presented to the outpatient clinic complaining of intermittent bright red stool for the past 3 years. She also notes a history of frequent diarrhea. Aside from these complaints, the patient, however, was very independent. She was feeling well. She had no other symptoms. Even at her advanced age, she was able to get up and move around the room without any difficulty. She did have a family history of cancer in her son, and she's also a former smoker with a 30-pack year history, but she denies any weight loss herself. Um, Concerning for any colon cancer, she underwent a colonoscopy 3 years ago at an outside facility. She states that she was told to have them yearly. However, she wasn't sure of those results at that time and hasn't followed up with any repeat colonoscopies. At her most recent visit, we'd ordered labs, and they did show evidence of an iron deficiency anemia with a hemoglobin of 10.4, total iron 32, total iron binding capacity of 381, and a ferritin of 7. Her physical exam was remarkable for systolic ejection murmur, which was consistent with the aortic stenosis. A repeat echo was done, and it did confirm the severe aortic stenosis with an ejection fraction of 65%. At this time, we advised the patient to continue iron supplementation and to try to find the results of her most recent colonoscopy while continuing to follow up with the clinic on an outpatient basis.
So, to paint the full picture, we've put two images on the poster. The first one shows the mechanism of acquired von Willebrand syndrome and how the blood flows through the stenotic valve, and the shear stress cuts the multimer and the atoms TS13, cleaves it even more, creating more hemostatically less competent monomers. And then the second image shows endoscopic image of colonic angiodysplasia. So if our patient did go to the colonoscopies, what we believe is we would see findings such as this picture in her colonoscopy suggesting that she has Heyde syndrome.
And in discussion, angiodysplasia of the GI system are the most common AV malformations and are usually found in adults over the age of 60. Aortic stenosis is another condition that becomes more common in elderly patients. In an elderly patient who has an established aortic stenosis who also develops an iron deficiency anemia, Heyde syndrome should be added to that differential. These patients first should undergo testing for any potential underlying malignancy, celiac disease, or other nutritional deficiencies. In our case, this patient did undergo her colonoscopy because they were worried about colon cancer. If the colonoscopy yields no sight of bleeding, Heyde should be considered, especially if it reveals evidence of any angiodysplasia. Further testing may be directed towards the diagnosis of acquired von Willebrand syndrome, with gel electrophoresis being the most sensitive test. Acquired von Willebrand syndrome may increase the incidence of angiodysplasia in a patient with Heyde's due to that increased neovascularization. Research has shown that von Willebrand factor acts as a negative modulator of angiogenesis. So decreased levels of von Willebrand factor can lead to increased activity of angiogenic pathways and increased circulating levels of endothelial cells and other angiogenic cytokines. So the management of Heyde syndrome is challenging, and often it needs a multidisciplinary approach. Treatment options include medications, endoscopic interventions, colon surgery, and aortic valve replacement. But treatment should also be personalized on a case-by-case basis, and whether that patient has any evidence of active bleeding. In our case, our patient is 89 years old, and at her advanced age, she may not be the best surgical candidate, but if you encounter another patient in practice who's younger, a better surgical candidate, aortic valve replacement may be something that you can suggest to these patients. We've included a list of references in the bottom right, and we thank you for listening to our presentation, and we hope you have a great day. Thank you.